jumping in my ride. Looking like your money, think about it, getting on the rich man. Acting like
Medication absorption is the movement of a drug from its site of administration into the blood. Oral drugs enter the stomach, where they either dissolve and pass through the cell membranes of epithelial cells lining the stomach, or travel undissolved through the stomach to the small intestine, which is the most common site of absorption. Here, drugs dissolve and pass through the intestinal wall. Oral drugs then travel through the portal venous system to the liver, where they undergo the first pass effect. During this process, the liver metabolizes some of the drug, either inactivating it or excreting it into bile for elimination from the body. The remaining amount of active drug leaves the liver and reaches general circulation and target organs. If a drug is administered via intravenous injection, it passes directly into the bloodstream, thus bypassing absorption in the GI tract. If administered through intramuscular or subcutaneous injection, the drug enters either muscle or subcutaneous tissue, where it passes through gaps between cells into capillary walls and then into general circulation or target organs, also bypassing absorption in the GI tract. Bioavailability is the net amount of a dose of a drug that is actually absorbed into the bloodstream. The bioavailability of oral drugs is less than 100% because of the first pass effect of the liver. In contrast, the bioavailability of IV drugs is 100% because they are not exposed to the first pass effect of the liver. Different drug formulations alter bioavailability because they are not absorbed at the same rate or to the same extent. For example, tablets dissolve at varying rates. Enteric-coated drugs dissolve in the small intestine, not the stomach. Because gastric emptying time differs between individuals, absorption times also vary. Sustained release formulas contain tiny spheres that dissolve at different rates, resulting in a steady drug release throughout the day, but also resulting in variable absorption. Some factors affecting drug absorption are the rate of dissolution. Drugs that dissolve faster are absorbed faster. Surface area. Since the lining of the small intestine has more surface area than the lining of the stomach, most drugs are absorbed faster in the small intestine. Blood flow. The greater the concentration gradient between the drug-filled stomach and the rapidly flowing drug-free blood, the faster the absorption. Lipid solubility. Highly lipid-soluble drugs pass through the phospholipids in the cell membrane more easily than drugs of low lipid solubility. And pH partitioning. Absorption is faster when the difference between the pH at the site of administration and the pH of the plasma attracts more drug molecules to ionize in the plasma.
Hey, doctor give me something called Bextra. I think it works for back pain.
Wait, I thought Bextra was only for arthritis.
That's what I thought too. But it works on a lot of people.
Are you sure it's safe for that?
No idea, but it's from Visa I think. So it should be okay.
I'm not sure. I read somewhere Freezer got into trouble over this drug.
Really? What kind of?
I think they promoted it for use, not approved by health authorities.
That sounds serious. I'm gonna read more about this.
Yes, better check before you take anything risk.
Pfizer's medicine Bextra was licensed in the U.S. to treat the pain and inflammation of chronic arthritis. But the pharmaceutical giant thought it could be used to treat other illnesses and wanted permission from Washington to market that information to doctors and patients.
Your prescription card.
The government said no, but Pfizer went ahead anyway with the marketing. Now, government lawyers say it's time for Pfizer, an apparent repeat offender in illegal marketing, to take its medicine.
When off-label marketing like this occurs, patients' health and lives are put at risk, and those who cause that risk must be held accountable.
Under an agreement, Pfizer will pay $2.3 billion in civil and criminal fines. The criminal fine, nearly $1.2 billion, is the single largest fine in U.S. history. The U.S. government will also supervise Pfizer's behavior for the next 5 years. The settlement covers the marketing of Bextra and several other Pfizer products. Company officials said in a statement they were ready to put this behind them. We regret certain actions taken in the past, but are proud of the action we've taken to strengthen our internal controls and pioneer new procedures so that we not only comply with state and federal laws, but also meet the high standards that patients, physicians, and the public expect. Watchdog groups say that for a company that's worth $110 billion, the punishment doesn't go far enough.
Even for Pfizer, this is a drop in the bucket for all their profits. The penalty should be larger.
But the company and some healthcare analysts say it's the system that's also at fault. Because although drug companies aren't allowed to promote their drugs for anything other than their original use, there is nothing that stops doctors from giving drugs to their patients for any reason they want. That loophole still hasn't changed. Rosalind Jordan, Al Jazeera, Washington.
Hey Lena, I checked the news. Pfizer was fined over $2 billion.
All because they promote Bextra illegally, right?
Yeah, they told doctors to use it for unapproved conditions.
That could hurt a lot of people. No wonder the fine was held.
It's scary how even big companies break the rules.
Major drug companies have been caught red-handed marketing drugs for unapproved uses. Now, even after pledging not to do it and paying millions of dollars in fines, guess what? They're at it again. Let's go now to Monica Bertrand for all the details. Monica?
It's Carl, it seems that way. The practice of marketing drugs for uses other than what's on the label has been going on for years, and it's a huge moneymaker for drug companies. Pfizer has paid some of the largest fines in the industry after promising to stop marketing drugs for off-label uses in 2004. Just 2 months ago, its pharmacy and Upjohn unit agreed to plead guilty to promoting a drug approved only for the relief of arthritis and menstrual discomfort, now for treating all kinds of acute pain. Now for this, Pfizer has to pay the largest criminal fine in U.S. history, $1.19 billion. So why do drug companies continue the practice? Well, in short, as we mentioned, off-label sales are a huge moneymaker. According to a study by Stanford University, about 15% of all drug sales in the U.S. are for unapproved uses. Estimates show doctors write more than 10 million of these types of prescriptions each year. Dr. Sidney Wolf, director of health research at Public Citizen and editor of worstpills.org, says it's a serious problem, but he's not sure it will really stop.
It is dangerous, maybe not in every instance, but I would say in the majority of instances, people have been injured or killed as a result of illegal off-label promotion. Unfortunately, the companies are making so much money off of the illegal promotion that when they pay only a fraction of what they made in these penalties, they just keep doing it.
And despite promises to stop the practice, Pfizer, Eli Lilly, Bristol Myers Squibb, and 4 other drug companies have paid a total of $7 billion in fines and penalties since May of 2004 for, again, marketing those medicines to doctors for unapproved uses. Scarlett?
And Monica, $7 billion is not insignificant. Aren't these big pharma companies concerned about all these fines adding up?
Not at all, but take a look at the stats, Scarlett. Pfizer has paid a total of $2.75 billion in off-label penalties since since 2004. It works out to a little more than just 1% of the company's revenues of $245 billion from 2004 to 2008. And Eli Lilly, they already had a criminal conviction for misbranding a drug when it broke the law again, promoting its schizophrenia drug Zyprexa for off-label uses starting in 1999. The medication provided Lilly with $36 billion in revenue from 2000 to 2008. That's more than 25 times as much as the total penalty, so you can do the math. Now, you can call it a legal fig leaf if you'd like. Essentially, companies skirt the problem because there are no real reprisals, I should say, other than paying the fine. A parent company can continue to participate in, say, government programs even after its subsidiary has pleaded guilty to marketing drugs off-label. Scarlett, back to you.
So no real disincentive here for the companies to stop doing this.
And they're making a lot of money, you can see, compared to the revenues they take in for the drug.
A lawsuit was filed today against the drug maker Pfizer. That's the company that makes the now pulled pain reliever Bextra. It was removed from the market last week after it was linked to heart attacks and serious and sometimes fatal skin reactions. Let's talk with Ken Mall. He is the senior partner with the law firm Kenneth Mall & Associates. State the plaintiff's basic claim here, sir.
Well, we have 5 plaintiffs from various states, including one in Illinois, complaining of heart attack, pulmonary embolism, and skin reactions.
And the claim you're making against Pfizer?
Well, we have a worldwide class action lawsuit against Pfizer for all users of Bextra. We have them in 2 different categories: those that suffered serious injuries or died from Bextra. We're seeking compensation for their injuries. The other class of individuals took it and want the funding to get medically tested or seek a consultation from a physician to see if they have symptoms that may lead to injuries or death in the future.
Now, the other products under this COX-2 inhibitor label are Vioxx and Celebrex. Vioxx has been pulled by Merck. There's also Celebrex, which is still in the market, but it has a much sterner warning now required on the label. Are you making a similar claim against Merck as in this whole case?
Well, we filed last October a worldwide class action against Merck with respect to their Vioxx, which was pulled from the market in September. We represent over 6,000 clients from around the world in 54 different countries. Just recently, the FDA panel met in February and said all COX-2 inhibitors unanimously, in unanimous vote, 32-0, can cause serious heart attacks, pulmonary embolism, stroke, and skin reactions.
What is it you're claiming specifically that the companies did or didn't do?
Well, they knew that the COX-2 selective inhibitors could cause heart attacks and serious injuries and failed to warn consumers, which the FDA is now requiring them to do with a black box warning, which is the most severe warning they can give. But I think what's more important was what the FDA did last Thursday. They said all NSAIDs, or non-steroidal anti-inflammatory drugs, must contain this black box warning. That includes ibuprofen, naproxen, Aleve, Advil, Motrin. So it's a class effect is what they're saying.
And you're saying this validates your basic claim?
That's correct.
All right, Ken Mall, thank you very much, sir.
Thank you very much.
Hey Jana, I used to trust big pharmaceutical company, not anymore.
Same to me. Now I always check if a drug is approved before taking it.
That's why ethnic and law are so important in healthcare.
Pfizer's case is a warning to other companies: don't put profit over safety.